Okay, so today we're going to talk about TCM first aid and first aid kit for TCM practitioners and acupuncturists. So when we look at first aid kit, first we see it's a predominantly Western medicine idea, but in the old times, doctors in China, they also have their own travel kit that when they travel lands that they use. When we look at this type of first aid kit, we need to first think about what type of material you need, what kind of conditions you're going to see, and what kind are emergencies. So the first response, the type of material you need for first response. When we see a first aid kit, first thing you're going to see is the box. So I have a couple of different boxes here. These are something you see pretty standard at everywhere, with a red cross, and everyone see it, they know instantly it's a first aid kit. So something like this, metal, it looks very professional. It'll keep the things inside safe from the weathers. Over here we have a more rustic box. It looks like it's been around for a while. What it says is that you're an experienced practitioner. People will give more trust to you if you show up with something like this. Over here we have a more modern type, like a metal case here. These are more what you see on ambulance nowadays, and and these type of things you see on ambulance nowadays. So these are some of the common boxes. The type of box you present would dictate how much people will trust you. All these stuff can fit into a paper bag, and you use Sharpie and draw a cross on it, it shows a first aid kit. But if you pull out a paper bag and say, trust me, I'm going to treat you, they're not going to give you consent, they're not going to put much faith in you, and it's just unprofessional. So I would suggest first thing is to look how do you want to present yourself? How do you want people to look at you? When you see this box, how do you feel? So next, we look at the content. As soon as you open the box, you're going to have all these stuff inside. What are the first things that you're going to have access to? When you build a first aid kit, you need to think about what kind of conditions you can treat, what kind of conditions you're going to encounter. So when I build something, I think of common things that I need in a first aid kit. Cuts, burns, bruises, these are more common. And then sometimes, we're in Canada, so during winter you might have frostbite, cold, and that kind of stuff, or heat waves and that kind of stuff. You're going to have different type of conditions, and you're going to need different tools for these. So as soon as I open my first aid kit here, I have access to sterilized gauze, different sizes. So I think that the first thing for most important is like when you have open wounds, most commonly you're going to have open wounds. So gauze, we have different type of gauze, and you can decide what kind you need that stops bleeding. So make sure there's, for all open wounds, you need sterilized products, and also you need gloves. So next we're going to move into the type of gloves. So because it's sterile, because it's a kit, it's going to be a travel pack. You don't need like a huge container of it. You just need a couple. After you use it, then you're going to replenish it. That's the idea of first aid kit. Don't bring like a whole packet of gloves and bring it everywhere to travel. That's a lot of stuff to carry. So these are mainly for emergency kits. So over here I put together like a little packet of gloves, and as soon as you open it, it's the inside, it's reversed, so you can open it, and where you contact the glove, it should be fairly simple to put on without having to contact the inside of the gloves. So that's that. Next thing we're going to look at are the alcohols. So you always want to keep everything clean and sterile. So you want alcohol. Usually it's the standard is 70 or 75% alcohol. These are the best. So these you can get really cheap at Shoppers Drug Mart or Dollar Store or Medimart or anything like that. You can get the spray bottles for alcohol. Remember, once you open the seal, you should change the alcohol bottle every year because alcohol evaporates very easily in these type of kits. So after you use it, you know, you can carry it on, put it in your clinic or whatnot, and then put a new fresh bottle in there. So it doesn't evaporate when you use it. It doesn't become, you know, 10% alcohol and 90% water. Another substitute for alcohol are these alcohol pads. So we have one here and one here. So probably something smaller, or even if you only need a couple, just take out a couple and carry it with you. 3M is probably the best one you could get, but any type would do, as long as they're sealed, and it should be latex free wipe, because it's very common you meet latex, people who are allergic to latex. So these type of alcohol swipes, very easy. You open one when you need it, and that's it. So if you carry like these, you have 6 uses. So these are pretty easy in substitute for alcohol. But if you carry alcohol, you always need cotton balls. So what we have here are 2 types. These are the common ones you see in clinics. They use the cotton ball swipes. Another one I find very easy in when you're outside in the field, I find the cosmetic, they have these, I've seen girls use these, so I found these makeup pads that are cotton pads. They're very easy to use. They're very clean. They already separated for you. So I find the problem with cotton balls when you're in emergency is when you grab it, all stick together. You have to separate. It creates a mess. These are already cut out for you, so you just grab 1 or 2, and then you can spray alcohol on it and use it. So I highly suggest these ones over the cotton ball from experience. So it's just something to think about. Next, we can talk about, let's see, what we have here are first aid kits that we get from, so this one we have is a recreational first aid kit we purchased from Shoppers Drug Mart. This one is, I think it's $16, and it came with everything you need. So these will save you a lot of money and time for like common traumas. They have Band-Aid, alcohol wipes, scissors, gauze, gloves, burn creams. So to add this into your current first aid in your TCM first aid kit is it just saves you a lot of time, saves you a lot of trouble. So this is something I added separately that you can think about or consider. Now, what makes our kit TCM and different from the Western Medicine first aid kit are because we're TCM practitioners, so we are more experienced in a different type of modality, a different type of treatment. So we're going to talk about that right now. So when you have heat symptoms, what do? We do bloodletting. That's usually the first sign. So bloodletting in the fingertips, bloodletting in the 少商商阳, which is lung 11, large intestine 1. So we can carry Lancet bloodletting pens and Lancets. So this is one type. You can find these in any store actually. In the diabetic section, they have these like bloodletting pens, and the pens are multiple use, but the needle inside, what you do is you take these out and the needle is one-time use. So once you're done with it, you take it out, throw it away, and the pen could be reused again. This is one type of lancet. I find these very useful in clinic situations, especially for if you have one patient. I would stick with these in clinic. So these are really easy, you can think about. On the field, I would suggest a one-time use needle. So I have here a one-time lancet. Because you're on the field, you want to keep everything sterile. You want things to be used one time and throw it away and be done with. So these are a one-time use needle. You twist the tab off. You can adjust for the depth and then do lancet anywhere, ear tip, fingertip, and you can throw it away. Or you can use their traditional needle, which is Sennington, the 3-edge needles. Now these are for more aggressive, serious conditions when people have a wind stroke and stuff like that. These, you can see, are much, much thicker, and you can do more aggressive needling. So when people are unconscious, you can use these, because I don't think they'll let you do it when they're conscious. So, but these are very effective for emergency situations. So I would keep those handy. So after bloodletting, these are usually for emergency situations. After that, we think about what type of other conditions you're going to meet. So cuts, bruises, burns, these are other common conditions. I usually have something like these that we made ourselves. So burn creams, cut creams, these are relatively easy to make, or you can get them at Herbal Depot or any Chinese medicine shop. So these are very effective. You always keep one or two of these little jars around, and they're very, very easy. So when you use these, you need to remember, always keep your glove on. So your glove is always before where you keep these, so you have very easy access to the gloves first. That barriers you from any open wounds, cuts, and sores, and anything like that. So I would put these under the gloves. So when you're emerging, sometimes you don't think. So put it under where the gloves is. First you pick up the gloves, then you remember, put it on, then apply these creams.
Next we'll talk about. Next we have. Okay, let's talk about what's next. On the side here we have needles. So these are Carvel sample packs that I picked up from Carvel. You can pick up any needle company. They're pretty much, they're pretty similar. What you want these are because they're packed very neatly and very, very nicely. So if you go to your local needle shop, sometimes they have sample packs, and you could pick them up, and they're all tucked away nicely, ready to use, ready for you. So when you have needles, you need to remember you always need sharps container. So after you use them, the standard for using needles, after you use them, you need to have a container to dispose them of. Now I've looked around in the market. It's hard to have sharps container that are travel sized and very tiny boxes. So we have here like a business card case. These are very easy. What these could do for you is you want to put needles in it only for a short period of time, and when you can, dispose them in a proper sharps container. But these they'll stay closed, and they won't have needles everywhere and create a huge mess and create some biohazard into your box, and you might poke yourself. So okay. So a minute ago we talked about needles and the Carvel sample packs. Another way that you can do is create your own little package of needles. So what I have here are these CD containers. This one's for photograph, but you can use any of these containers. And what you would do is take
because they already have the setup for you. So they have the clear filament here and a spot for you. So what we have in our clinic is we use boxes of needles, and then you just take what you need. So this is a standard 2.22 40 millimeters, so 1.5 chin, and you just slide them right in like this. There, you just slide a couple and see what size you need. These are larger. These are, I think, 3 chin. 125, yeah. So you can just slide them right in. These will stick out a bit, but you just slide what you need in. After you're done, seal it up. There, you have your needle pack. So these will be tucked away very nicely in your first aid kit without having a whole box. So compared to these will save, create your own pack would save a lot of space.
Just to remind you, this is an emergency first aid kit, so it's only for temporary and it's only for short-term use. So if you can once in a while take these out, switch it up, because they do have needles, they do have expiry dates. So you want to, so these expire 2019, so you probably want to use them up before 2019. So switch them up once in a while. It's probably the same time you would switch up your alcohol, just use up everything in your box and then just put it back in, and it's pretty easy, and you just use them. Let's see. Next we'll talk about Moxas. So Moxa is another tool that we use in Chinese medicine. They're mainly made of
Moxaweed, so Moxaweed. So you can have the pre-packaged one, so these are pre-packaged, or you can get loose Moxa. Pre-packaged are very nice, very clean, and they have different types depending on the condition as well. So if they have like yang deficiency or qi deficiency, you can use different types of Moxas that you can tuck them away, and you can use them for different conditions, or you can have herbal Moxas. So, and then use them on appropriate points.
There's these ones. Sometimes if the person, they have qi deficiency or yang deficiency, they faint indoors, it's inappropriate to use Moxa because there's a lot of smoke. Another option you can use is smokeless Moxa. The way smokeless Moxa works is that they usually burn Moxa into carbon. So some people say they emit similar infrared frequency as a proper Moxa. So you could consider using these in indoor situations, emergency situations. People also for giving birth, their fetus is shifted. You can use Moxa to trim the fetus in emergency situations. So these Moxas are very good to use for some of the conditions. So going back, Moxas and the different type of tools that you put into your box is dependent on what type of emergency conditions you're going to meet. So sometimes, especially as Chinese practitioners, you might not have people to help you when an emergency situation arises. So you want to prepare as much as you can. So we have like Moxa tools here, and other things that you can apply onto the body before helps arrives.
So you have these type of tools that you can place onto the body with a base, so you don't burn them, but you can apply it on there, leave it there while you do some emergency resuscitation or training on techniques and stuff like that to regain consciousness. So Moxa is a good tool for emergency situations.
Another tool that we use that are very good is Guasha Tool. So over here we have a couple different types. For standard, you probably only carry one, but here's different types to show. So Guasha, there's different materials. So you have metal, you have wood, you have stones, quartz, jade. Personally, I think for most versatile is probably the Bianshi, the stone, because they're initially cooling properties, and after a long-term use, you can warm them up. So you have these ones, you know, when people have wind invasions to the neck, you can guasha their neck, do it on ink tongue here. If they have heat stroke, you can guasha in the center here. So these are very good tools. You always keep one around, and they're very, very small, so they're very easy to carry. If you can't find one, you can always use coins, but I find coins have a sharp edge. Sometimes you might injure them. With Guasha Tool, you always carry around lubricants. So we have gel here. You can always consider to use massage oil or any type of oil or cream or lotion if you can't find any. Some people always carry lotions with them, but we keep in our first aid kit gels and oil. So we have a warming oil here, which is a ginger oil, and then a cooling lymphatic detox massage oil. So whichever one you think you're gonna need more or you're accustomed to, you can put that in. Another way is what I have here is same thing, sample packs. So I have these Bond Vital. So in massage stores, they always have these sample packs. These are great things for your first aid kit because they give you just a little bit, just enough to fix in your bottle. Or you can get your, you can go to dollar store and pick up like a small spray bottle. And these type of bottles you can have for, you know, small travel size empty containers and build your own travel size oil. Over here we have these cleanse concentrate. So these are mainly for the tattoo artists. If you ask any tattoo artists, they would know. These are to clean, but they also have numbing agents in it. So if they have bumps and bruises and they're in a lot of pain or sprain their ankle, these are temporary numbing agent in that you can use before you do some manipulations, bone setting, or any treatment like that. Somewhere in the side, I always keep a N95 mask. So in case of some bacteria or viral spread or anything like that, these are probably the standard for in hospitals that they use. So these, I always keep one handy. So that's just there. Oh, sorry. With Moxa, you always need something to light it with. So nearly forgot. There's different types of lighters. The common one you see in the market are probably the big lighters. They release these type of red flames. They're easy to use. They're very cheap. I find these a little weak for Moxa. So I have here, you can probably get these in dollar store. I got mine in dollar store as well. These type of torch lighters. So you can't see the flame, but the flame's more concentrated. They produce a higher energy or a power, or they're hotter. So these light up Moxas very quickly. In emergency situations, you want your tools as quickly as you can to have everything ready in the shortest amount of time possible. So in clinic, maybe a red flame is fine, but when you're rushing, you need something lit, you need it lit now. So torch lighters are highly suggested. We also keep some candles here ready. If you need a constant flame, you light it up. And candles are right useful. Here we have the elastic bandage, pressure band-aid. These will cut off circulations if you have any open wounds or if you need to cut off any circulations. I just keep them aside, but they would come, elastic band-aid would come with the life recreational first aid, so you don't need to grab a second one. Next, which is another common one to keep, is Yunan Baiyao. Comes in different forms. This one is pill form, comes in a pill case. This is a spray form, and then the traditional box. So what Yunan Baiyao does is it's a patented medicine, and mainly it stops bleeding. You can use it in open sores or any type of open wound. These are very useful. So the way you use pill is if the person's bleeding, you open up the pill and then just spray it onto the area, and then you can apply gauze and then wrap it up or use Band-Aid. So these are very useful. I would suggest either the spray or the pill, because pill's already packaged and spray's already packaged, so you just spray it on and it's done. So these are something that you can keep very handy for any open wounds.
Okay. Next is, let's talk about the cupping.
So sometimes bloodletting is not enough. You need to cup out the blood. So I have here these silicone cups.
Easy to use. You just squeeze, and they're relatively strong. So you can first do your prick, let the blood out, and then you just put the cups right over it, and then you can leave it there and they'll do their magic. So you can find these online. They're very easy to go on eBay, type in just silicone cup or silicone cupping, and that's how I got mine. So that's how you can find them online.
And then some other common conditions for diarrhea and constipation. I would suggest if you're not herbalist, if you're not familiar with herbs, stick with acupuncture. Use Tianshu Stomach 25 or things like that. If you are familiar with herbs, you can always create your own pills. You can use Huoxiang Zhenqi San, the same formula, put it in a herb grinder.
What we did here is the same thing. We used a herb grinder. We put Huoxiang Zhenqi San formula in it, and then grind it, and then put it in capsules, seal it up, and then we always keep a couple of these or any other type of common conditions, and then you can put it together like that. Let's see. Oh, so this one I have, which is pretty old. This one is 麝香保心丸. So these are for people with so if you meet somebody that's going through a heart attack or anything like that, same thing. If you're a herbalist, you can use herbs. If you know anything about herbs, you can use these. If not, I would suggest you do the same thing. Heart attack, palpitations, you could go back to acupuncture or bloodletting. You have those tools. If you do know herbs, you can carry some, build your own herbs or buy patented medicines. Keep one in your box for emergency purposes. I've kept one Angong Niu Huang one from in my box before, but what I find is during summer, because Angong Niu Huang is kept in wax, in the summer the wax would melt and get everywhere and ruin your box. And it's not a cheap medicine. I think it was like $80 $90 for Angong Niu Huang, and then it's ruined. So I would suggest you to create your own, put it in capsules. They don't melt too much, like they don't melt in the summer, or create your own pill and they don't melt. So it'll save you a lot of trouble with cleaning up and stuff like that. Something on the side I keep, ear seeds. So, 王不流行子 ear seeds, these are very good for, for ears. You can put it on for any microsystem. So, if you know your microsystem for the hand, for the ears, ears are very effective for instant pain relief, very short term, for a couple minutes. So, people twist their ankle, you can use ear seeds, do some temporary pain relief before they let you do something else other than numbing agents. So, I always keep a pack handy, and they would be useful when you have any type of instant sprains and anything like that. Always, I keep a pack of 小针刀 knife needling if you know how to use them. You can always, same thing, put in your CD pack right here. I just keep a pack there. pressure band-aid, and which is, you know, for open wounds. These are pressure band-aid, which is you can find them in shoppers as well. And I think that's about it. Other than that, I have a pack of Moxa. So basically, it's just a normal heat pad. During winter in Canada, it can get quite cold. So these are very good for during winter. If you're stuck in the middle of nowhere, you need some heat before helps arrive, CAA arrives, you can get your heat pack out before you freeze to death. So I keep a pack for our winter, you know. So that's basically what I have in my first aid kit. So you think about what type of conditions you're going to meet, think about what you're capable of treating, and put the tools together. That's how you pack it up into small travel size packs and put it into something presentable. And that's it. Thank you.